So now we will explain the cardiac preload. Okay, we have already explained the contractility. Now we will explain the cardiac preload. So cardiac preload is actually the load that is, for example, the load come here that is not ejected. That is called preload. Okay, so preload is ventricular wall stress at the end of diastole. When diastole is end, all blood move to the ventricle and diastole become end. At that time, the stress is called cardiac preload. Law of Laplace state that wall stress is directly proportional to pressure, resistance, and wall thickness. So we have already discussed in the end diastolic lift ventricular volume is to the cardiac preload. For example, if cardiac diastole and diastolic volume is high, cardiac preload is high. Okay, affected by 5 factors. One is the venous pressure. If their venous pressure is high, rate of venous return is high, the cardiac preload is hard. Atrial contraction. If atria contracts strong, the ventricle, the preload becomes strong. Okay, become high. Resistance from the wall. If the resistance from the wall is increased, okay, the preload is also increased. Ventricular compliance. How much, for example, if ventricular compliance is less, then the preload is so much high. If the ventricular compliance is so much is high, for example, they can accumulate more blood, so the preload is less. Okay, now the first thing is the venous pressure and venous return. It is so simple. Venous pressure, for example, venous tone is one vasodilating factor, another is vasoconstricting effect, another is the circulating blood volume. We will explain. Now first, venous tone. Vasodilating factor, for example, if the more blood come here, okay, the ANP is released. ANP is actually venous tone. Decrease the venous tone, it decrease the end diastolic volume, it decrease the cardiac preload. Actually it ANP actually do dilation of the artery, renal dilation, renal arteriole dilation, and more blood go to the renal arteriole, renal and the kidney, and more water is excreted through NP, and less blood move toward the heart again. Okay, another is vasoconstricting effect. Vasoconstricting effect is the sympathetic stimulation. For example, vascular tone, vasoconstriction occur, and diastolic volume is increases when the vein is constrict. Okay, when the vein is constrict, so what will happen? More blood move to the atria. Okay, and cardiac preload is increased if the vasoconstriction happen. Okay, venous tone is in vasodilating venous tone is decreased, venous blood return is also decreased. Okay, now another thing is the circulatory blood volume. For example, this is the amine. Okay, so there, for example, now normal there are 5 liter. If the volume is become decreased, okay, to 3 liter, etc., that is called hypovolemia. For example, dehydration or injury occur, so their volume become decreased, and that also decrease the end diastolic volume, and the preload is also decreased if the blood is removed from the body or dehydration is occur. Okay, so now in the graph you can see this red line is actually the, for example, you see this is the volume. Okay, if this increase, volume is increased, so this is normal volume. If the volume is decreased, now you can see this the end diastolic volume is really decreased, and the preload is also decreased. For example, this is actually the preload. If you see this pressure, the pressure is also, if the volume is decreased, pressure is also decreased, so the preload is decreased. Now this is the hypervolemia. If the transfusion overload, if more blood transfused, so end diastolic volume is increased, preload is also increased. Okay, now this is about the things vasodilating factor. Now this is vasodilating factor, this is vasoconstricting factor also happening here. Okay, and also this is vasoconstricting factor and also hypervolemia, and this is vasodilating factor or hypovolemia. Okay, another is the about the atrial contraction. In atrial contraction, first thing is the force. When there is more force, sympathetic stimulation, and diastolic volume is increased, preload is increased. If the atria contract, pumping is less, atria arrhythmia. For example, atria arrhythmia. In atrial arrhythmia, for example, this is the atria. Okay, atria contract not like this to contract like this, from this to this, but it contract like this as a vibration, not contraction, as a vibration. That is called arrhythmia. Okay, so the all the blood can't move, can't eject it, so that's why end diastolic volume decrease, preload is decreased, is in the atrial arrhythmia. Okay, now we will tell about the resistance from the wall. Inflow resistance and outflow resistance. There are two resistance. So in inflow resistance, it is actually atrioventricular wall. Atrioventricular. This is the atrioventricular wall between the atria and the ventricle. If narrow, if it become narrow, so less blood move inside. Okay, and another is the outflow resistance. If it become narrow and aortic pulmonary, so more pressure is needed to empty, so less emptying. Now you have to understand that if this wall is stenotic, so less filling will occur and the preload become decreased. If the aortic wall is aortic and pulmonary trunk wall is stenotic. Stenotic mean narrow. Okay, stenotic mean narrow, become narrow. So emptying, less emptying occur and become preload is increased. If the emptying is less, so preload is increased. For example, this is the ventricle. If blood move to here, all the blood now present here. So this is called preload. If less blood is moved out, so the preload less blood, so the blood is remain here, so the preload is increased. Again more blood is coming, but less, more blood is coming, less blood is moving out, so the preload is increasing and increasing. Okay, in this way. Now another thing is the ventricular compliance. For example, this ventricle, if 2 liter blood come here and they can occupy 3 liter, so here is the preload is less. Okay, if you, for example, another ventricle like this have only 1 liter compliance, not 1 liter, but we is just assuming. Okay, if one, it is 1 liter, so they can occupy 3 liter and it can occupy 1 liter, so the compliance of this is less. So if the 2 liter is moved to this and 2 liter is moved to this, so the preload is must be greater here because it can't occupy 2 liter and it occupy 3 liter. So here is the load, the stress is less. Here is the stress and the load and the preload is so much high. Okay, you have to remember this thing. Now another is the heart rate. Heart rate, for example, normal 60 to 100 beat. Abnormal fast. If the heart rate is fast, that is called tachycardia. Reduction feeling. For example, the heart rate is so much increased. What will happen? For example, the heart rate is so much increased. The things will happen that the reduce feeling. It actually reduce feeling. The feeling become reduced. Okay, the preload become decreased. The preload become decreased. This is simple things about the heart rate. Okay, now we will explain the Frank Starling mechanism.